Hello, everyone. Today we're going to be discussing how to identify the osteopathic principles in practice in your quality improvement project. A fair amount of this presentation has been assisted by AI. However, the content has been vetted by me. Let's start with running through a scenario. It's 10 a.m. Saturday morning. You're walking down the empty halls of a community college to attend a BLS recertification course. We show up as the earlier class is finishing up. Let's watch them.
All right.
So, assessing the situation, are they breathing?
No, Rose, they are not breathing, and they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
All right, well, let's get back to it, because you're losing them. Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it.
Right.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, I do. I love that song. First I was afraid, I was petrified.
No, it's Staying Alive,
Okay, yes,
Staying
yeah.
Alive.
You were in the parking lot earlier. That's how I know you.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Words it loud, women more, been kicked around since I was born. Well, it's alright, it's okay. You can look the other way. Let it go, let it go.
Staying alive, staying alive.
Yeah, okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911, so you lost him.
Okay, he's dead. Anyone know what we do next? Anybody? Rose?
I have no idea.
Anyone else?
We bury him.
Wrong. Check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet. I checked.
He is an organ donor.
He is?
Yeah.
Give me some ice in a styrofoam bucket. Here we go. We search for the organs. Where's the heart? The precious heart.
I'm not feeling well. I need to sit down.
Sit down.
Hey, Stanley. Are you okay?
Oh my God.
At ease.
Oh my God.
Can you tell me why you had to cut the face off the dummy?
I didn't think it was very realistic in the movie, and it turns out it's pretty realistic.
We had to pay for it. It cost us $3,500.
$5,300 for a dummy?
Wow.
Okay, look, David, this is why we have training. We start with the dummy, and we learn from our mistakes, and now Dwight knows not to cut the face off of a real person.
This is funny, and no one here would behave like this. But how often does our system design create the same chaos, just more quietly? As you're watching that video clip, ask yourself, what part would you change? What core competency is at the root of this change? Is it skill proficiency, medical knowledge, self-evaluation and learning, management of healthcare system, communication, or professionalism? What goals are you trying to achieve? How can we improve patient care? Taking one step further, how does this impact the patient as a person? How does this impact the medical team members functioning as a unit? How does this impact the many components of the healthcare system? For example, by having accurate MedRec, there could be less medical reconciliation errors, which means the body's self-healing workload is not stressed with unnecessary medications. Another example, resident well-being and workflow could be improved if the handoff was consistent and reliable. We all know a happy resident means a happy patient. Improved patient compliance by improving the clarity of the discharge instructions. This helps the patient be accountable for their care or their ability to self-regulate. Another is improving the workflow by reducing barriers such as transportation, which is similar to addressing the person's structure or social determinants to improve their function or ability to show up for appointments. That's a lot of questions and possibilities, and can feel overwhelming. Let's take a different view and see if we can make the steps more manageable. The three common QI themes are process reliability. How do we make this step happen at the same time every time? Outcome improvement. What patient outcomes do we want to change, and what process drives it? Waste reduction. What are delays, duplications, or unnecessary steps? We need to remind ourselves that behind all these projects, graphs, and statistics lives a person, and that collectively we treat the person, not the disease. The first tenet, the osteopathic tenet, is the body is a unit. The person is mind, body, and spirit, essentially meaning that all of our systems within our body, like cardio, pulmonary, renal, are not independent of each other and are interconnected. Another way of looking at this is expanding the definition of a unit to include groups or teams like the rapid response team or the stroke team. From there, the members of the EMS to the emergency medicine, ICU, radiology, and lab, they're all interconnected as a unit or medical health system. The second tenet is the body is capable of self-regulation. We as physicians typically see our patient when their dysregulation overcomes the body's ability to self-regulate. We provide the tools and the resources to optimize the body's self-regulation and function. The third tenet is if the structure of the system is disorganized, then the result is dysfunction or poor care quality. The last tenet is the rational treatment is based on all three, essentially meaning we take into account the person as a whole. Let's watch this video again, this time through your osteopathic lens, and spot where the osteopathic principles show up. When you see an opportunity for quality improvement or patient safety, ask yourself, which of the four osteopathic tenets does this represent?
All right.
So, assessing the situation, are they breathing?
No, Rose, they are not breathing, and they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
All right, well, let's get back to it, because you're losing them. Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it.
Right.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, I do. I love that song. First I was afraid, I was petrified.
No, it's staying alive,
Okay. Yes,
staying
yeah.
alive.
You were in the parking lot earlier. That's how I know you.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Words are loud, women warm, been kicked around since I was born. Well, it's alright, it's okay. You can look the other way.
Staying alive, staying alive.
Yeah, okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911, so you lost him.
Okay, he's dead. Anyone know what we do next? Anybody? Rose?
I have no idea.
Anyone else?
We bury him.
Wrong. Check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet, I checked.
He is an organ donor.
He is?
Yeah.
Give me some ice in a styrofoam bucket. Here we go.
What are you
We search for the organs. Where's the heart?
brush is hard.
I'm not feeling well. I need to sit down.
Sit down.
Hey, Stanley. Are you okay?
Oh my God.
At ease.
Oh my God.
I'm sure there's a lot more examples that I didn't mention in that video clip. Now, osteopathic physicians know osteopathy, but assume that it is being practiced. We can't identify the osteopathic principles in practice in their work. The point is, we're not adding or integrating osteopathy. We are identifying what is in our work and making osteopathy intentional. Your QI project will be scored on 3 osteopathic categories, with scores ranging from 0 to 4. 4 points is awarded when 3 of the 4 osteopathic tenets are written on the poster or mentioned in the verbal presentation. This is for both the application and background portion of the presentation. 2 points is awarded if the poster mentions at least one of the 4 osteopathic tenets, either in the poster itself or verbally in the presentation. OMT is the last category, with 4 points awarded when the OMT technique is mentioned and included in the poster and or mentioned in the verbal presentation. 2 points is mentioning application of OMT, including possible next steps. 0 points for not including OMT or including any OMT technique. A sample background for this project would be cardiopulmonary resuscitation, CPR, is a time-critical intervention that significantly impacts physiologic self-regulation, survival, and neurologic outcomes in patients experiencing cardiac arrest. Although evidence-based guidelines from the American Heart Association define standards for high-quality CPR, variation in real-world performance remains common. The text in the yellow highlights are examples of where the osteopathic tenets can be written on the poster or verbalized in the presentation, depending on your flow. Continuing on, the high-quality CPR requires appropriate compression rate and depth, minimal interruptions, full chest recoils, and effective ventilation. Performance gaps in function often results from skill decay, communication challenges, unclear team roles, and lack of real-time feedback during resuscitation events. In addition, respectful and professional behaviors towards patients, even during emergent resuscitation, supports the patient's mind, body, and spirit, strengthens team communication, and contributes to the improved clinical outcomes and family trust. Quality improvement projects like this provide a structured approach to assess current practices, identify barriers, and implement interventions such as simulation trainings, standardized team roles, feedback technology, and post-event debriefing. This project aims to improve CPR quality, promote respectful patient-centered care, and enhance team performances to optimize patient outcomes. So, how would you grade this background? Overall, we had, through that written or verbalized background, they had some components of 3 tenets of the osteopathic principles. You had the body is a unit, demonstrated with respectful and professional team behavior towards the patient affects the clinical outcome. Structure and function, where chaotic training and organization leads to poor patient care. Self-regulation, poor CPR technique decreases the patient's own physiologic ability to regain circulation. So from those examples, I would score this 4. Sample methods is this quality improvement project used a standardized high-quality CPR training video as a primary educational intervention. This video demonstrated optimal chest compressions, coordinated team roles, effective communication, and respectful patient-centered behavior. Clinical staff involved in resuscitations participated in scheduled sessions that included video viewing followed by facilitated discussions highlighting CPR quality metrics, role clarity, teamwork, and maintenance of patient dignity during resuscitation. Participants then applied concepts in simulated scenarios. Pre- and post-intervention assessments evaluated CPR performances, team communication, and respectful patient interactions through observation, feedback, surveys, and structured debriefing to measure improvements in resuscitation practice and team culture. Let's take a look at the video that would be used for this quality improvement project.
It's essentially picture perfect CPR. Everyone knows what to do. There's not a lot of talking. We need to have someone doing chest compressions, but we have to rotate that compressor every 2 minutes to ensure that we're still getting quality compressions. We have to have someone leading the call.
Have the controller person set up on the left side of the patient, and then compressor is always going to be on the right side of the patient, and then you have someone at the airway.
And then you need someone to be a liaison with the family. There's some people to be arranging a way to get the person out and get them into the medic unit and get to the hospital. You know, to fill all those roles, you're looking at around 9 people minimum, and 12 is way better.
Anybody who it's not their time, we want to give them the best chance, and not just of getting pulses back. We want to try to make sure that one day that they're going to make it out of the hospital.
We put so much emphasis on it, on being one of the most exceptional things that we do here at South County Fire, because it's saving people's lives, right?
For the call to come in, for units to be dispatched, for us to get there, it takes a few minutes, and that's a few minutes of not having oxygen to the brain, not have oxygen to the heart. The more people that know CPR, the more AEDs that are readily available in the community, the better outcomes are going to be for people.
Special credit to the South County Fire Department for this video. The conclusion for this sample QI project can include the yellow highlighted fonts or text in either the poster or mentioned into the presentation. You can get points from either or. Okay, so implementation of standardized timely CPR training reinforced both technical performance and respectful patient-centered behavior during resuscitation. This encompasses the osteopathic tenets. The body is a unit, has abilities for self-regulation, and structure and function are interrelated. Emphasizing high-quality compressions and coordinated team roles helped optimize patient physiology while maintaining dignity in emergent care. Improved team structure and communication enhanced overall function, demonstrating a practical and sustainable impact on resuscitation performance and clinical outcomes. How would you grade the practical application or potential impact of the last couple sections? Did the poster and/or presentation discuss at least 3 of the 4 osteopathic tenets? Or did it only discuss at least 1 of the 4 osteopathic tenets? Or did it not discuss any at all, with respective points awarded to 4, 2, and 0 points for each of those categories? Okay. The next steps that you could discuss would be, could the patient benefit from osteopathic manipulative treatment to optimize their body and health? Now, as a reminder, this is where you can have it written or just verbally during your presentation. This is probably where I would verbally include this, that we could consider gentle techniques like myofascial release to the chest and upper back after the patient has been stabilized for at least 24 hours. We can also progress to an OAD compression for autonomic balancing. We would avoid rib raising because articulating possible rib fractures sustained from the CPR could complicate the care. Now, how would you grade that portion of the presentation? Okay. Would Would there be 4 points for including OMT as part of the project? Or would there be 2 points for mentioning application but did not include any OMT? Or 0 points for not including or mentioning any application of the OMT techniques? Overall, I would score the osteopathic portion of this quality improvement project of 10 out of 12 possible points. 4 points for the background of the project because it did discuss at least 3 of the 4 osteopathic tenets. 4 for the practical application because it did discuss 3 of the 4 osteopathic tenets. And 2 for the OMT section because it mentioned it, however, it did not include any OMT techniques in their presentation or poster. Remember that behind your quality improvement and patient safety project are everyday people. And the point of the osteopathic portion of this is to make osteopathy visible and intentional. And I hope this presentation gave you more light to seeing where you can find osteopathy in the 4 tenets throughout your regular practice and this quality improvement project. If you have further questions, I'd be happy to answer them, anything osteopathic or even with the rubric or how you can integrate the osteopathic components in your quality improvement project. Okay. Thank you so much for your time.